Well, everybody's heard the phrase, our children are our future. Everybody knows our children are our future. There's nobody would argue with that. And this concept is in dire straits. We're in grave danger of losing everything here. First of all, the experts are telling us now that our children will not live as long as us. Our kids are the first generation that will not live as long as their parents. Our kids are going to die before us. That doesn't mean you're going to die at 75 and your kids 10 years later will die at 72. That ain't happening. What they're talking about is you will be standing at a gravesite burying your children. This is just a heart jerker, and not only that, it's going to wreck this country. Just think of China. They had one child per family rule, and they wanted boys. Well, now they've got one whole generation that's 99% boys, no girls. They have a huge problem, a self-inflicted problem in China. Well, let's look at birth defects. Birth defects are a self-inflicted thing. There's not a single birth defect that is genetically transmitted. That's a pretty bold statement, but I can prove it. We've eliminated every birth defect you can name and 10 times that many you can't in the animal industry with good preconception nutrition. That includes supplementation with all 90 essential nutrients, leaving nothing to chance. We don't have health insurance for animals, and so if we have a calf born with cleft palate, cleft lip, the farmer's got to kill that calf. Not going to feed it. You're certainly not going to keep it for breeding. And then what if the calf is born with spina bifida? He's going to have to kill that calf. He's not going to go through all the machinations to feed it and get it old enough for market. It's going to be much more expensive than a normal calf. And then what about Down syndrome? What about being born deaf as a simple deficiency of a single mineral? What about cerebral palsy? And what about homosexuality? All these things are caused by nutritional deficiencies during pregnancy, all preventable. And so it's a simple thing for us to take charge of our future. Our kids are our future. And so I'm urging everybody, instead of giving a $100 bill for Christmas or birthdays or anniversaries, instead of giving a $100 bill for baby showers, instead of giving a $100 bill for a wedding shower, instead of giving a $100 bill for anything, give the 90 essential nutrients. And when do you start giving the 90 essential nutrients? Well, before a baby's conceived, all through the pregnancy they're developed in, from the moment they're born. And you do that. The goal here is for them to be well beyond 120, 150 before they die. And we want them to have a very, very boring health file. The only thing we want in their health file when they die at 120 is their birth certificate. Now, I'm telling you, I have not been to a doctor with me being the patient in 68 years. You think about that statement. I haven't been to a doctor with me being the patient in 68 years. The only thing I have in my health file is my birth certificate. I've never been on a prescription drug. If everybody in America were like me, health-wise, medically, the medical system would be very, very humble. And you throw in the piece where we know that medical doctors kill, injure, and infect 15 million of their customers in the workplace. They don't even get an OSHA ticket. That's per year. They kill, injure, and infect 15 million of their customers. Doctors kill more people a year than the mafia has in 1,000 years. The single most number one cause of death in America is doctors. Not car wrecks, not epidemics of Ebola virus, not AIDS, but doctors are the number one cause of death in America. People wake up. Okay, so I want everybody to contact their Youngevity associate and get a hold of the 90 essential nutrients. And if we take the 90 essential nutrients long before we're old enough to have our own families, guess what? Our families will be wonderful. Our families will be free of birth defects. We've done it in the animal industry, and people and doctors will say, well, that's in animals. In human beings, it's genetic. That's absolutely, positively not true. Whenever a doctor says something silly like that, I want you to jump in their face and say, liar, liar, pants on fire. This is a very simple thing. I want you to really get our new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. You think about it. We can be a birth defect-free country. It'll take, one series of pregnancy. If we start today giving every child, every young adult, everyone who's sexually active and still in the age where they can have kids, within a couple of months we'll be able to eliminate all birth certificate, all birth defects. We'll be able to eliminate all birth defects. I mean, I get so excited about this, and people say, well, it can't be that simple. It is that simple. You just have to have the will. You have to have the will to give up the bad stuff, the fried foods, the processed meats, the oils, the gluten, so you can absorb things. You are not what you eat, you are what you absorb. And so I urge you to take this seriously. Contact your Youngevity associate today and get a hold of that book, Epigenetics. The subtitle is the most important piece, The Death of the Genetic Theory of Disease Transmission. Just think about it. The halls of science are filled with dead medical theories. You can't name me a theory that's held up under time and scrutiny. Every one of the medical theories has either been chopped up. Here's another one of my favorites. Things like mad cow disease, Creutzfeldt-Jacobs disease in human beings. Everybody says it's the prions. It's not the prions, it's a simple copper deficiency. Oh, yes, they failed to satisfy Koch's postulates with the prion theory. You haven't heard about the prions in the last couple of years, have you? The whole thing has been dead because I deal with people with Creutzfeldt-Jacobs disease, and guess what? It goes away. We'll be back after these messages. Okay, Billy, you're sitting in for Doug today. What pearls of wisdom do you have for us?
Well, there's a very interesting story in the news. It headlines like this: low vitamin D during pregnancy is linked to a child's cavity risk. Women's low vitamin D levels during pregnancy are linked to a higher risk of cavities in the teeth of their toddlers, according to a new study done in Canada. Previous studies have shown that vitamin D deficiency among mothers can lead to defects in the enamel of their toddlers' teeth, which have already begun to develop in the womb, as we know, and that these defects can increase the risk of tooth decay. Dr. Robert J. Sharath from the University of Manitoba's Dental School in Winnipeg and his team wondered how low vitamin D levels in mothers during pregnancy would also translate to higher cavity rates for their toddlers. They measured vitamin D levels in the second or early third trimester in 207 pregnant women, not a large study, but a study nonetheless, and they examined the teeth of 135 of their children when they were an average of about 16 months old. Mothers-to-be were recruited from a predominantly poor urban area. And depending on what the definition of cavities is that the researchers used, 23 to 36% of the toddlers had bad cavities. So prenatal vitamin D levels were significantly lower in women whose toddlers later had cavities than in the women whose toddlers did not have cavities, according to the findings published Monday in the journal Pediatrics. So interesting study.
Yeah, exactly right, Billy. And of course, it's a form of a birth defect. Dental caries or cavities that babies are born with or develop within 2 years of being born because of a mother's deficiency of vitamin D3 during pregnancy. And I guarantee you that mother wasn't just deficient in vitamin D3. That mother was deficient in calcium and magnesium and phosphorus and sulfur and who knows what all else. This is why, of course, we are in control here. Is it not better for our society to make sure that every child or every young couple who are in the childbearing years, sexually active, that they get all 90 essential nutrients? That should be our priority. This country, this should be our priority, to make sure that we eliminate all birth defects. And we're talking about even ones that are what we would call inborn errors of metabolism, Billy, things like lactose intolerance, fructose intolerance, PKU, type 1 diabetes, sickle cell anemia, thalassemia. These are what are called inborn errors of metabolism, and they're caused by the mother missing something during the early stages of pregnancy. All totally preventable. Totally preventable.
What's so interesting about this for me, Doc, is that you've been harping on this since I've known you. I mean, years about, look, if you get the proper nutrition, you give your baby all the tools it needs to develop properly, you help the child grow into a person that doesn't have any problems. It just makes a lot of sense.
Yeah, well, basically what you're doing is epigenetics. When you take prenatal vitamins, you take the 90, not just some usual prenatal vitamin with 28 nutrients. You take the 90, 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, and you can eliminate all birth defects. I mean, you think about that. That's epigenetics, the death of the genetic theory of disease transmission. And I think that's worth a couple of flourishes there.
Well, I would play the flourish, but I'm afraid I'm set up for something else with this new system we're using.
Well, that's okay. Let's go.
I do the worst flourishes known to man by myself.
But yeah, truly, we've eliminated every birth defect you can name in the animal industry, and 10 times that many you can. So why should our cows and rabbits and rats and chickens and dogs get a better deal than our kids? Even after the kids are born, all baby formulas have less than 20% of the minimum daily requirements they need for minerals and vitamins. Less than 20%. Woo! Dogs get 100%. Chickens get 100%. Well, we'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages. Okay, Billy, let's go to callers.
All right, Doc, let's head to Betty in Maryland. Betty, you're on with Dr. Wallach.
Hello, Betty.
Yes.
How can we help you?
Dr. Wallach, I'm a new I have type 2 diabetes. I'm 67 years old. I'm not over, but I have been diabetic since 2000, the year 2000.
How much do you weigh, Betty?
160.
Okay. Do you have any other issues like skin problems, any eczema, dermatitis, psoriasis, or any history of asthma or constipation or diarrhea?
No.
Okay. Do you have children?
Yes, but she's 47, I think.
Okay, so you have an only child?
Yes.
Okay, now does she have a history of asthma or skin problems?
She has some skin problems.
Okay, like eczema or dermatitis?
No, nothing like that. I think just
Dry skin?
a little acne. Yeah,
Acne?
a little acne. But,
Okay, does she have adult acne?
What kind?
Adult. I mean, she still have acne as an adult?
Yes, she does, just every now and then.
Mm-hmm. Okay, I got you. Okay, do you have a pen and paper, dear?
Yes, I do.
Okay, now this is a Shar thing, so I want you to write down what Shar says, and I will kind of fill in the pieces here. And Shar, Betty is 160 pounds, and she has type 2 diabetes. What would you do for her?
She needs 2 healthy blood sugar packs, and she needs to get on a gluten-free diet immediately, and she can do that right away. No wheat, barley, rye, or oats, because that's caused the problem in the first place.
Okay, excellent, excellent, young lady. And of course, Betty, what I want you to do is take 2 healthy blood sugar packs per month. That'll be 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangy Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 3 of the Sweeties at breakfast and dinner. What I want you to do is take your fasting blood sugar every morning before you medicate yourself. Now, are you on insulin or are you on pills?
No, I'm not on anything now because I went to a naturopath doctor last year, and I was taking chelation therapy. Mm-hmm. And my veins just gave out. I mean, I just got so I couldn't stand to be stuck anymore after about a year of that.
Okay, so what was your blood sugar the last time you checked yourself?
I went to the doctor about 2 weeks ago, and it was 250.
Okay, well, you know, and he's not putting you on any medication. What I want you to do is get this as soon as possible. Start the diet today. No fried foods, no processed meats, no oils, no sugar, no gluten, no wheat, barley, rye, oats. Call us every 2 weeks. I want to know what your blood sugar is. We can help you wean off your medication, go back to a normal life. We'll be back with Dead Doctors Don't Lie for these messages.
All right, Doc, let's head to Michigan and Lindsay. Lindsay, you're on with Dr. Wallach.
Hello, Lindsay. You're on the air.
Hi, Dr. Wallach. Thank you for taking my call.
Yes, ma'am. How can we help you?
Well, I was told that I'm anemic because I bruise very easily, and I'm wondering, how can I tell if I actually am? Like, what are the signs or symptoms, and if I am, what do I do about it?
Okay, well, signs of anemia can be a rapid heart rate because your heart's pumping blood through you faster and faster trying to get more oxygen. Because if you have less red blood cells, you can't be efficient carrying oxygen around. You can be weak, sleepy all the time, can't be strong, have no stamina, prone to all kinds of things, including infections. Your tissues don't work, your brain doesn't work, your liver doesn't work very well, your muscles don't work very well because they're not getting enough oxygen, food. So anemia can be a very dangerous, even life-threatening thing for adults as well as kids. Now, I have to ask you a couple of quick questions here, Lindsay. First of all, how old are you?
I'm 23.
23, okay. And do you have any other diseases that I need to know about? Anything like eczema or dermatitis or psoriasis or rosacea?
Not anymore.
You did have.
Yeah.
How long
And
you been
I
on
took
a
out
gluten-free
bad
diet?
foods.
Yeah, how long
About
you been on
a year.
About a year. Very good girl. Very good. Now, did you have asthma also?
No.
Okay. Did you have belly
I had
problems?
a lot of skin problems.
Had a lot of skin problems. Are they gone now with a gluten-free diet?
Mm-hmm.
How'd you learn about a gluten-free diet and how it was connected to your skin problems? How did you learn that?
Well, when we first heard about you and you said to get rid of all the bad foods, gluten was one of them, and once I reintroduced it again, I started having problems again, and so I've been off of it for a while now.
Well, you're very
Now that I
smart for a
know.
23-year-old lady, let me tell you, to do that experiment. She got rid of her skin problems by getting a gluten-free diet. Then she introduced gluten again. The skin problems came back, and she knew that it was a gluten problem. Good girl, very smart. You know, you're smarter than
Thank
all
you.
doctors in America except me. Very proud of you. Okay, now, so also when you have a gluten intolerance, it's more difficult to absorb nutrients, so it's not unusual for somebody to be anemic when you have a gluten intolerance. It could be one of the many diseases you can get. And how much do you weigh, Lindsay?
200.
Okay, and how tall are you, kiddo?
Like 5'5".
Okay, so if you're 5'5", weigh 200 pounds, I would say that you're, say 50 to 70 pounds overweight, okay? And so what I want you to do, are you taking the 90 essential nutrients yet?
Yes.
Okay, now are you working, or are you married? Are you staying with your family? How are you paying for all
Yes,
this?
I live with my family.
Okay, good girl. You know that your brothers and sisters have to be gluten-free? You know that they have to get on the 92, otherwise they're in trouble?
Yes.
Okay, good for you. So you're going to be my poster girl here, so I want you to hang on, and Shar and I are going to give you a program after these messages. Okay, Billy, let's go right back to Michigan. And Lindsay, one more question here before I turn you over to Shar here, Lindsay. Being on a gluten-free diet, have you lost any weight over the last year on the gluten-free diet?
I've lost 60 pounds.
You are a champion. You lost 60 pounds. And, yeah. Now, what are you on longevity products?
Absolutely.
And which ones are you taking?
I take the Healthy Start Pack along with Glucogel, Z-Radical, and I think that's it. And
Okay, well, I'm very proud of you. Yeah, for a 23-year-old young lady to take the healthy, and of course, ideally, if it's not a financial burden, be 2 of the Healthy Start Packs, is 1 per 100 pounds of body weight. So be 2 of those, a full dose of breakfast and dinner. If finances are a problem, then you take 1. And of course, the Z-Radical is great for your immune system. And the Glucogel, did you have joint and back problems too?
kind of.
Okay, and have those problems gotten better?
Yes.
Okay, now I'm going to have Shar put her input here, how she can help you speed up the weight loss. Keep doing what you're doing. You're doing a great job. We're so proud of you. But I want you to be one of my poster girls, so I want you to keep good records, keep, a log, how much weight you're losing, and so forth. So here's Shar, and I want her to tell you what to do to add to your program to lose weight a little bit faster.
Okay, to speed it up, you can take the ASAP. It's as slim as possible, as soon as possible. They're little drops. You just put a dropper full under your tongue and let it absorb into your body. And it should speed up your weight loss considerably. And as long as you're taking all the nutrition, you're going to be fine.
Exactly right, Shar. Thank you so much. And of course, you put those drops under your tongue 30 minutes before each meal. You leave them absorb through your oral tissues. Do not swallow them. And it will speed up your weight loss. But the fact is you've lost 60 pounds on your own. I'm so proud of you. And you will be one of our poster girls, because we want you to teach so many other young people to be healthy like you. Thank you so much, Lindsay.
Thank you so much.
Okay. God bless you.
You saved my life, Dr. Wallach.
Well, thank you. Thank you for being so kind as to share your information with us, because you're going to save a lot of people by telling your story. God bless you, young lady. Okay. All right, Billy, let's go to callers.
Let's head to New York and Zuli. Zuli, you're on with Dr. Wallach.
Zuli, you're on the air. Hi, how can we help you?
Okay, this is my situation. I have some bacteria in my stomach, and so my doctor say I have to have surgery, and I had the surgery, and I had antibiotics for 1 year. So the surgery is good, but I went to my primary doctor, and she say I had my liver is swallow, my sugar level is very high, and later she say I had thyroid. So she say she gonna put on me in some medicine, and I say to her, no, I don't want to take medicine. I wanna study more when I had. So I went to some doctor, natural doctor, and she do the text, and she say I know how the thyroid. What happened is my flora, my stomach is destroyed for the antibiotics, and right now I not absorb the vitamins and minerals.
Okay, how much you weigh, Zuli?
130.
Okay, now, when you said your doctor did surgery because you had bacteria in your stomach, did you have a gastric ulcer?
What you say?
Did you have an ulcer in your stomach? Why did the doctor do surgery?
Because I have something, I have some little hole in my stomach,
Okay.
and I live in Palm Beach, so
Okay.
say that bacteria coming from the water.
Yeah, okay, I gotcha. Now, you said you also have liver problems, and your blood sugar is very high. Did he diagnose you with type 2 diabetes?
No. She say I have to be careful with the sugar. So it's like the sugar can be very high. So I'm be careful with that.
Okay.
And my liver is very swallow. I guess it's because the antibiotic for 1 year.
Okay,
And,
very good. You got your pencil and paper, Zuli?
Yes.
Okay. So, 130-pound Char. She has liver problems. Her liver's swollen. And she been on antibiotics for a long time. So she might need some probiotics. And what would you give her? Where would you start her out at 130 pounds?
Well, I would give her one healthy start pack, and then I would add the selenium for the liver.
What else would you add for the liver? Something. I'd add one more thing for the liver.
De-stress.
De-stress, very good. Okay, and what would you do for probiotics?
Oh, I would get the triple treat chocolate.
Well, yeah.
It tastes good.
Okay, that's Gurley's favorites, right?
Yeah.
Triple treat chocolate, very good. Okay, Zuli, you want to take one healthy start out there. That would be a tablespoon, which is a half ounce of the Osteo FX Plus at breakfast and dinner, 1 scoop of the Beyond Tangy Tangerine 2.0 Nutri-Crystals at breakfast and dinner, the 3 EFA Pluses, 1 at breakfast and 2 at dinner, or 1 at breakfast, 1 at lunch, 1 at dinner. And the Char says, for the liver, I'd have you take 3 selenium twice a day. That's going to do several things, including give you more, support your immune system because of this chronic bacterial stuff. So I'd have you take 3 selenium twice a day. That'll be 2 bottles a month to support your liver. 3 of the de-stress capsules twice a day. That's 2 bottles a month. Again, that's to support your liver function. And Char is exactly right. The triple treat chocolate and 130 pounds, you could take 4 of those a day. 2 at breakfast, 2 at dinner. I'd recommend you get the box of 100. It's a little bit cheaper because less packaging. When you buy them in the boxes of 20, it's a little more expensive because of more packaging. And so you'll be very happy with that. Give us a call every couple of weeks. Let us know how you feel, how your energy is. I want to know how you're sleeping. I want to know your weight. And let us know how your liver is. If it's tender in your liver, let us know. And it wouldn't hurt, just for kicks, go on a gluten-free diet. Let's do that. Although you didn't complain about anything associated with gluten-free, but give us a gluten-free diet for 90 days and then call us every 2 weeks. Let us know how you're doing. Let's see if that's a factor. Okay, Billy, let's go to callers.
All right, Doc, let's head across the country to Monterey, California, and talk to Donna. Donna, you're on with Dr. Wallach.
Hello,
Hi, Dr.
Donna. How can we
Wallach.
help you? Hi.
Hi, thank you for taking my call. I have a question. My son-in-law was diagnosed with spondyloarthropathy and fibromyalgia, And the doctor put him on Humira, and he did feel better, but he's only 28. He used to play rugby quite a bit, so he may have some kind of nerve damage. I'm not sure, but he doesn't want to take this stuff.
So you got spondylosis, is that correct? Spondylosis and fibromyalgia.
Right, and on the Humira, he did feel better, but he doesn't want to take this stuff for the rest of his life because he's only 28.
Well, Humira is only going to subdue symptoms. It's not going to resolve either of these problems. Okay, they're both nutritional deficiency diseases, so I have to ask you a question. Does your son-in-law have any skin problems, any eczema, dermatitis, or psoriasis, or rosacea?
He has had some skin problems, yes.
Mm-hmm. Okay, does he have any history of respiratory problems, any chronic bronchitis or asthma?
No.
What about, did he ever complain to your mother-in-law about constipation or diarrhea?
No.
Okay. Well, hang on.
Okay.
When we're back, we will give you a little program for your son-in-law. I do need to know how much he weighs, okay? And we'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Billy, let's go right back to California and Donna. Do you know how much your son-in-law weighs, Donna?
Yes, he's somewhere between 195 and I believe 200, something like that.
Okay, so we'll call him 200.
Okay.
And basically what he's going to need, and I have to have you appreciate this, and because he's had a skin problem, it means he has a gluten intolerance. I want him to get off of all gluten, no wheat, barley, rye, or oats, so he can absorb stuff. And these two diseases very frequently go along with gluten intolerance because they can't absorb the nutrients, as you'll see in just a moment.
Okay.
So gluten-free diet, no fried foods, no processed meats with nitrates and nitrites, no deli slices, sandwich meat, sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, etc., etc., etc. No oils, no olive oil, no coconut oil, no margarines, mayonnaise, salad dressings, or cooking oils. And then I want him to have 2 healthy bone and joint packs per month. That'll be 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. All that will be accomplished by the 2 healthy bone and joint packs. And that's designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. And then specifically for the fibromyalgia, I want him to also have 3 of our selenium twice a day, 3 at breakfast, 3 at dinner. That's 2 bottles a month. Spondylosis, spondylothesis, ankylosing spondylitis, where there's kind of a welded chain kind of effect between the vertebrae. The bone spurs from one touch the bone spurs of the other, and they fuse together. And that's all caused by raging osteoporosis.
Okay.
It's not autoimmune. The doctors, of course, why they gave him Humira is because they believe that, falsely, but they believe that it's due to an autoimmune process like lupus, very similar to lupus. And of course it's not. It's just simple nutritional deficiencies brought on by a gluten intolerance. And of course, within a couple of days, he'll notice a huge difference. Within a couple of weeks, it'll be really noticeable, very dramatic. And within 90 days, he'll be a new man. And depending on the degree of spondylosis, if he's really seriously afflicted, it might take 4 to 6 months to be completely gone, but he'll see dramatic benefit very quickly. Fibromyalgia goes away very quickly. It's a simple deficiency of nutrients required by muscle and connective tissue. So please do give us a call every 2 weeks. You're welcome to call more frequently if necessary, but give us a call every 2 weeks. Give us kind of a progress report on your son-in-law, will you please?
I will. Thank you so much.
Okay, Donna, thank you for sharing the story with us.
Okay, take care.
You bet. Okay, Billy, we got time to start another one. How much time we got?
We got about a little under 2 minutes. Let's go to Calgary, Alberta, Canada, and June. You're on with Dr. Wallach.
Canada, you're on the air, June.
Hi, Dr. Wallach.
Hi.
We came to see you when you were here. My friend is type 2 diabetes, and she's overweight, 200 pounds. She's been on the product for 2 weeks. Now, her blood sugar is coming down.
Good.
She's happy with that, but she has lost no weight. And she has used the ASAP, and she's on the gluten-free diet and trying to stay away from everything else. Now,
okay, now I want you to stop there.
Sure.
If she's taking the ASAP and she's taking 2 healthy blood sugar packs per month, because there's 1 per 100 pounds of body weight, she weighs 200 pounds,
That's correct.
and she's on a gluten-free diet, she's taking ASAP, a dropper full under her tongue, not 1 drop, but a dropper full under her tongue, 30 minutes before each meal, leaving it absorbed through her mouth. There's only one possibility here why she hasn't lost any measurable weight, and that's because she's not absorbing her nutrients. Okay? So somebody in the household, whether it's her dog or a cat, man, mother-in-law, kids, there's somebody in the household still eating gluten. The whole household's got to be gluten-free because of cross-contamination in the laundry, the food preparation surfaces, the couch where everybody watches TV, in the bed. There's somebody eating gluten in the house. She cannot have it in the house. Okay, that's the only reason. Obviously, she's got to restrict calories. She can't be eating 10,000 calories and expect to lose weight. And if she's absorbing, she will lose the weight. So she got to really crank down her gluten. Thank you for sharing, June. Call me back in a couple of weeks after she's really cranked down on the gluten. Thank you, Billy. Thank you, Susan. Superlative job as usual. Thank you so much, Shar. Really great stuff. Thank you. Great testimonies today. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.